If you have questions, feel free to unmute yourself and ask those throughout the meeting, as well as if you have any questions or comments during the presentation, please feel free to put those into the chat box. We're going to have a guest speaker here very shortly from the National Association of Counties, Mark Ritacco, who is the Deputy Director of Governmental Affairs with NACO. And Mark will be sharing the latest and greatest information from the other Washington. I've invited him out here to the real Washington as soon as the COVID is over, and we'll get him out here. But he will be bringing us up to date on what's happening with COVID-19, additional federal funding, things like that. And then we'll talk a little bit about CARES funding. We'll make some comments about Safe Start rollbacks, and then we'll talk a little bit about a public health resolution. So that's where we are at, and wanted to again welcome you. Thank you for joining us, and let me introduce to you Mark Ritacco, who is the Deputy Director of Government Affairs for NACO. He's been with NACO, gosh, what, since March, somewhere in there, April? I can't remember, Mark. You're responsible for COVID now, since it started when about the time you joined NACO. So thank you very much for joining us here. Mark's got some slides and we'll share his screen, but he has joined us, and really appreciate that, because it's 6:30 on a Friday evening back in Washington, D.C. He drew the short end of the straw. So we will we'll thank Matt Chase and Deborah Cox for making sure that Mark was here. So Mark, go ahead.
Thank you so much, Eric, and thanks for everyone for being here. It's an honor to be with you tonight. As Eric said, I joined NACO in March. Perfect timing. I also had my wife had a baby on March 24th, so it's been a wild couple months for me. But it's again an honor to be here and an honor to be working on these issues. I came from the United States Senate, where I'd worked for 7 years. And before that, I spent 6 years in the House. So I'm pretty familiar with what's going on in Congress. And, you know, what you're seeing right now is a reflection of how Congress has behaved for the last decade or so. So I'm not particularly discouraged by what seems like a paralysis, but hopefully we being Congress, can get something done in the next couple of weeks, because the situation remains dire out in America. So I'm going to share my screen here. Hopefully that goes well. Give me one sec. So first, the first thing I wanted to talk about was how we got here. And I can't see the chat here, Eric. So maybe if there's a question you could interject for me, if that's okay.
Yeah, we will introduce any questions if they come up. Yeah, go ahead.
Great. And you can just interrupt me. It's totally fine. So I just wanted to go over how we got to where we are. And what you should see on your screen right now is a slide about previous COVID-19 related federal action. And it's really interesting to look at these 4 columns here, because it's really, the congressional response evolved in the same way I think our societal understanding of the virus evolved as well. So it's an interesting little timeline, time capsule here. So all the way on the left, the first bill that Congress passed was primarily a public health response. You can see it was about $8 billion, which as we move forward in time, that amount of money is going to pale in comparison to what Congress has passed and what they will likely pass in the coming weeks. So the first response, as you see, was completely public health related, when we thought there was a chance to contain the virus from a purely public health perspective. The second bill was both a mix of public health response and economic response. So it was called the Family First Coronavirus Response Act, and it contained an increase in Medicaid. It allowed for coronavirus testing to be free. It gave some money to nutrition programs. There was an unemployment insurance component of it, because this was around the time, so I believe this passed on about March 16th. So this was the time when people were starting to lose their jobs, and we were preparing for people to lose their jobs. And it also had a major overhaul of paid and family leave requirements. One of those requirements was to the detriment of counties in many ways, because it required counties as employers to pay for paid leave as in response to COVID-19, but it didn't give the same tax credits at the end of the year that private businesses had. And that's a problem that we're still trying to get fixed in this package and in the next package and future packages. There's a few standalone bills in Congress that will fix that particular aspect of the Family First Coronavirus Response Act. And I hope you can see my mouse, because that's what I'm using to sort of gesture on the screen. The third bill was called the CARES Act, and I'm sure you're all familiar with it. You have an agenda item about it after this, so everyone's really familiar with the CARES Act and the Coronavirus Relief Fund associated with it. This, among many other things, allocated $150 billion to states and local governments. It established a municipal bond market stabilization fund. There were other sort of human service components to this bill, the local hospitals, and just a general appropriations in FY 2020 to all sorts of both public health and economic programs already established by the federal government. Fast forward to the beginning of, or I guess it was sort of mid-May, late May, they passed a package called, that we here in Washington, D.C. called 3.5. It was the fourth package. It shored up the Paycheck Protection Act, and it had some hospital funding as well. While all that was happening on March 13th, or I guess a little bit before most of the bills were passed, there was a disaster declaration that freed up $50 billion from FEMA's public assistance program to help states and local governments through the normal reimbursement process that normally occurs. So I'll stop sharing now and just kind of pause to see if there's any questions on what Congress has done, because everything I say going forward is going to be sort of prospective in nature. So if there's nothing on the history, let me share again and we'll go back to the presentation.
There are questions for Mark on either where we're at right now. I don't see anything in the chat box, and I don't see any hands raised. If you
okay,
want
let me keep going.
Unmute yourself for a real quick if you do have a question. If not, Mark, why don't you keep going?
Great. Okay, so that brings us to the implementation of the CARES Act as it's progressed over the last couple months now. According to our latest calculations, about $22.5 billion of the CARES Act has flowed to counties that were not eligible directly for the CARES Act. So as you all know or recall, counties above $500,000 got a direct allocation based on population, and counties under 500,000 people received a sub-allocation from their state, and Washington certainly being one of them. And to date, as of tonight, those sub 500 counties are at about $22.5 billion. And I say that number now because it's going to be important later when I show you what sort of need is out there in response to COVID-19. So anyway, the CARES Act, as I said, it was a $150 billion fund. The problem was, since Congress was rushing to pass bills, and you'll recall in March and April and May, it was, real sort of apocalyptic talk in DC, and rightfully so. Congress passed the bill very quickly and was not as specific as they could have been in the use of those funds. So the use of the funds was left for Treasury to interpret in many ways. So this is the guidance, as sparse as it is, the sort of guiding light and the Rosetta Stone for Treasury as they determine what are eligible uses of the CARES Act. So Treasury says that according to Congress, according to the bill that Congress passed, the Relief Fund can be used for necessary expenditures incurred due to the public health emergency with respect to coronavirus 2019, COVID-19. And that's it in terms of the descriptive nature of the fund. There are some time restrictions on it. These eligible expenses weren't accounted for in the most recently approved budget, which was March 27th, 2020, which was like basically a week before this bill passed, and that these expenses were incurred in the period that begins March 1st, 2020, which is basically the start of the pandemic for most of the country, although in Washington, obviously, the pandemic likely was percolating before that. But be that as it may, from Congress's perspective, March 1st was the date that eligible expenses would have to be incurred, and very importantly, the money needed to be spent, or the cost needed to be incurred before December 30th, 2020, which again becomes an important date in a couple minutes. So with all that in mind, we've had, basically 2 or 3 months now where the CARES Act money is mostly out the door for lots of places, some more than others. The money has been put to work, and Republicans in the Senate posture, Republicans control the Senate, as you know, their posture was that we would see what the CARES Act money would do to the economy. So that was, they after we passed the CARES Act, Senate Republicans said we're going to hit the pause button on any further legislation, and we're going to see what this CARES Act money does. And that really fast forwards us to this week. So this week we had headlines coming out of Washington, D.C. There's a new stimulus package. We're going to vote on it this week. Wait. We can't agree. Wait. Some Republicans want this. Other Republicans want this. President Trump wants a payroll tax cut. Democrats want something called the HEROES Act that was passed about 6 weeks ago now, probably longer. That was a robust $3 trillion bill in response to the COVID-19. And so there's lots of disagreement in Washington. And these are some of the headlines that were bandied about this week. And ultimately, where we are literally tonight is that we think that the text is written. We're pretty confident that the text is written, but it hasn't been officially introduced. An outline has been introduced, and maybe introduced is a strong word. An outline has been leaked, but no text yet. But based on what we know and who we've talked to on the Hill, obviously me and my team are talking to people on the Hill all the time. And from what we can gather, the bill that the Senate will take up next week and the week after looks something like this. So I should say this is the start of negotiations. So to take you through the timeline here, Senate Republicans are going to introduce a plan that looks like, for state and local government purposes, looks like what you have on the screen. As I said before, Democrats in the House already passed a plan to provide public health assistance and economic assistance to state and local governments, and that bill was called the HEROES Act. So after this, what you're looking at, gets introduced, there's going to be a negotiation between Democrats in the Senate, Democrats in the House, Republicans in the Senate, and the White House to determine what ultimately will pass. But this is the starting point. And in some ways, it's quite alarming, and in other ways, there's promise. So I can't speculate on where the negotiations will go, but this is where they will start in the Senate. So Senator McConnell is going to introduce a bill which is called CARES 2, which is the 5th bill, lots of numbers, but CARES 2, which is the 5th overall bill, is going to have no additional money for state and local governments. And from NACO's perspective, that is insufficient. And we have research showing why that's the case. And, we don't need research to know that many counties across the country are really still struggling with the pandemic. Cases are rising in many places. I think it might be fair to say that cases are rising almost everywhere. And no additional money beyond the $150 billion CARES Act allocation is really an insufficient first start. However, we have intel that the bill is going to allow for counties and local governments to use previously allocated CARES Act money to make up for lost revenue, which is really, really good. It's really something that we've supported. I think it's the type of flexibility that counties want. And in my opinion, it's part of our intergovernmental partnership, is that each county should be able to decide how best to respond to the pandemic. And if that's, purely public health, then it's purely public health. If it's lost revenue, then it's lost revenue. So the fact that we're starting from a place that lost revenue will be included is really promising. Second really promising part of the starting point of the negotiation is that December 30th deadline, which is looming large for many people to obligate these funds, is going to be extended to 90 days after that local government's fiscal year. So if your fiscal year ends in June, it's 90 days after that. If it ends in January, it's 90 days after that, which is, again, I think some welcome flexibility. Because some counties we've heard, and maybe some of you folks as well, have received allocations that you'll need, but are worried about getting the money obligated before December 30th, 2020. It also will require a 15% local sub-allocation for CARES Act dollars. Now, I know Washington State is not one of these states, but in some states, the state governor has given 0 CARES Act dollars to counties below 500,000 people. And the Republican bill that's coming out next week would require that 15% of CARES Act dollars be automatically sub-allocated to county governments, or to local governments, I should say. So about half the states are already above that. Half are hovering right, or about another, maybe 35% are hovering right around 15%, and then the rest are almost at 0. So this 15% requirement would give counties across the country an extra $4.5 billion. The Republican plan that we expect to be introduced next week also will require that no funds from the CARES Act be used for pensions or retirement benefits, or to replenish state or local rainy day funds. And I'm interested to see the legislative text on that one in particular, because obviously money is fungible, and I'm not sure that can be totally prevented. So I'd be interested to see how that's written out. Number 6, really crucially important for local governments, is that states must maintain their own budgeted spending levels and can't use federal dollars to replace state spending, which therefore can't be used to replace money that goes down to local government. So number 6, I think, is a very welcome part and a good starting point for negotiations. And also good, but I don't think a huge issue, is that states can impose additional restrictions on the CARES Act once they sub-allocate to county governments. So for instance, the CARES Act says nothing about reopening schools. So a state couldn't say to a county, we will give you CARES Act dollars, you have to open schools though. Or you have to open schools and require a mask, or not require a mask, or you have to do something with your economy, unless otherwise you wouldn't get the money.
Hey, Mark,
yes.
This is Rick Johnson. Mark, I was just going to interrupt. Idaho has an interesting one that's brewing, where you're not going to get your CARES money unless you do a property tax relief, or do some degree of property tax relief for citizens. So they're adding criteria to it.
Yeah, it's really interesting because, again, this is the Republican plan. So this appears to be in response to Republican states who are imposing these types of restrictions. So perhaps Senator McConnell has something in mind here, what he does or doesn't want states to do to impose additional restrictions. So it's very interesting. And that one, let me reshare. That number 7 is almost guaranteed to stay. And I would imagine that most of these will survive negotiations. I think number 3, the 15%, is something that we could negotiate over. But most of these seem like a pretty good starting point for CARES Act. Now, again, I think most people, NACO, chief among them, would like additional money on top of CARES. But if you put these same restrictions for additional money, I think, from NACO's perspective, we would be fine with it. And in fact, some of these things are the things that we've been advocating for behind the scenes as well. So all in all, as far as the CARES Act goes, this is a pretty decent starting point. What's really not decent at all, and in fact quite bad, is that this $150 billion pot is all Senate Republicans, at least, want to give local governments, and that's a real problem. Before I continue to talk about local government funding, I just want to give you a snapshot on some, leaked, I guess is a strong word, but information that's filtered out to us about what else is in this bill. And I know from talking to Eric and from talking to a lot of you folks that from your perspective, this remains a public health crisis, and Congress's response should be centered around public health. For some places, that's not the case. Although, as I said earlier, I think cases are rising everywhere in America, and it will soon be a public health challenge as well as an economic challenge for everybody. But I know for you all, it's started as public health and remains a public health crisis. And so here are, I won't read them, but here are some things that is also in this bill, this draft bill, that funds public health in the United States. And all of these things are also good starting points. I think some of these numbers will change. Some of these numbers will be increased. I think the last bullet especially could become contentious because the talk around town is that the $105 billion that you see at the bottom of the screen here, that will be used to supplant any additional aid for state and local governments. And while that's certainly appreciated, education funding alone is not the type of additional relief that we really need. So I'm happy to take questions on that at the end.
Mark, could you go back a slide? I have a question that came in.
Sure.
Can you explain how to reconcile number 1 with number 6? Not understanding how you can use it for lost revenue, but can't use it to maintain existing spending levels.
Yeah, great question. So we interpret that, again, it's just a narrative description. We don't have any legislative text. But so we have research that I'll talk about later that says that there is a pot of money that is purely lost revenue and is not revenue associated with money that counties get from the state. So I'll apologize for not knowing exactly the revenue sources for counties in Washington, but there are some county-specific, county-exclusive revenue sources that, by our research, total over $100 billion. So those would be able to be used for number 1. And number 6 is basically a maintenance of effort, if you want to call it that, between states and the federal government. So states can't cut their budget or raise taxes and then equal amount to the amount of money that they receive from the CARES Act, is how we interpret this one sentence without seeing legislative text.
Thanks.
Okay, so the path ahead. Why can't Congress pass this bill right now? Because all that sounded pretty good. There's a few contentious issues, as there always is. And a few of those contentious issues, just to give you to let you all be a fly on the wall and of the conversations that we've had and the intense disagreements that we've been party to, is a few things. And this is kind of in order of importance, but not totally. So stimulus checks to individual Americans. It seems like everybody wants to give an additional round of direct payments to Americans. The amount of the stimulus and the income threshold, or income threshold for who to give it to is definitely a point of contention. We heard $40,000 and below. We heard $1,200 for $40,000 and below, and then sort of gradually phased out. So there's like kind of three sides to that argument. I think Senator McConnell wants $40,000 and below. I think Democrats would probably want more money at a slightly higher income threshold. And then there are others, which, we have to certainly be respectful of, because they have a point, is that talking about a lot of money here, and Congress has already spent over $2 trillion, and an additional round of stimulus is quite expensive, and in their view, it's money that we don't have. And from NACO's perspective, we're constantly trying to balance the fact that we want to be good stewards of taxpayer dollars, and we know that counties are good stewards of taxpayer dollars, and the debt and deficit are a real issue that we need to take seriously and that we need to address. And we're trying to balance that really serious issue with the urgent needs of counties. So the stimulus check sort of fight is also a fight about the debt and deficit. So that's a pretty big one. And then, almost as important is that the additional $600 from the federal government stimulus unemployment checks expired tonight, I think, or will expire on Monday. So starting on Monday, without additional congressional action, people will be losing a large chunk of the unemployment compensation that they've been receiving for the last couple months. Another big contentious issue is obviously state and local funding. Senator Schumer, who's the Democrats' leader, it's basically his number one issue, and it was a huge issue for the House bill, the HEROES Act, and to have no additional money for state and local is a really big problem, and certainly something that will be negotiated. And then the last point is liability protections, and for counties as employers, this is important. For the economy generally, it's important, and there is some real strong disagreement about the extent of liability protections. And I know there'll probably be a question on that. Let me just go to the next slide before I pause for questions on that or something else. NACO just released a survey of 200 counties across America to determine what the fiscal need is in overall. And every county is different, and every county has a different story to tell, and every county's finances are in a different place. So we did our best to extrapolate from those 197 different stories some key takeaways. And it's these key takeaways, especially number one on your screen, that inform NACO's advocacy. So we have, pretty solid methodology here that would suggest that there's a $202 billion need for counties through FY 2021. And you might remember me saying earlier that counties have only been basically allocated maybe a quarter of that. And so I won't read all of these, but the $202 billion is really important. And number three, I think, is really important to the overall health of our economy, where 71% of counties have cut or delayed capital investments, and 68% have cut services. And then, and again, I'll let you read the rest of these, but I would also just want to highlight number 6, which is that counties that received direct CARES Act money, 66% said that we don't think this is going to be enough. So if we pass a bill that only has CARES Act money, at least 66% of counties are going to find themselves in a fiscal hole when it's all said and done. So that number 6 and number 1 here really underscore, in our opinion, in NACO's opinion, the need for additional funding. So let me stop there. I might be a little over my time. I'll stop for questions. I see some in the chat. Eric, maybe if you want to answer them
Yeah.
to me.
Yeah, I will. Thank you. First, yeah, if we can get your slides, we will get those out. We have had actually a couple of folks that have asked for those either via messaging and or chat. So,
Great.
Mark, if you can forward us your slides, we'll get those out and posted. So that'd be very helpful. We have a commissioner out of the Chelan County area. It's a combined Chelan-Douglas Health District that has a $2 million hole associated with COVID response, and they are told they really don't fit the hospital health provider definition. So I think folks are really, I think that's an ongoing dilemma, is how do we get the necessary funding for our local public health jurisdictions, which are either a direct county function in Washington State, or our commissioners, council members serve as the body of an independent local health jurisdiction, but is trying to make sure we get enough money to support our local health jurisdictions who are in the front lines of the response.
Yeah, and it's again, the rush in passing the bill probably omitted some of these unique circumstances across the country. I think one of the best ways to do that would be to free up the CARES Act to be as flexible as possible, and to let states and let counties, let cities decide how to spend that CARES Act money with very little restrictions. The other is that there's a separate provider fund from HHS that Congress may use to address some of these specific local health problems on top of any money that comes to state and local aid. So we're hopeful about that. And again, we know that there's this huge need out there. We know that we've already spent a lot of money, and so just trying to weigh that. But on balance, I think these public health needs, and Eric, maybe it was even you who said it the other day, we also have to prepare for mass vaccinations and the public health challenge that will be sort of, I don't want to say post-COVID, but in the second and third phases of COVID, making schools more resilient, making our public health more resilient, preparing to vaccinate 300 million people. I mean, these are resources that we're going to need well into fiscal year 2021 and probably beyond.
Great, thanks. So if you have a question for Mark, why don't you put it in the chat box or raise your hand. Maybe one of the staff members can double check the hands that are being raised or not being raised, while I maybe ask just a general question about timing now. What is the timing for the Senate Republicans to potentially get a bill to the floor for a vote, and then negotiations between the House and the Senate? What are we realistically looking at in terms of a time frame?
Yeah, thank you for asking. I meant to say it before. So the August recess is supposed to be the hammer that spurs people to act. On Tuesday, I believe it was, Speaker Pelosi said that she's willing to postpone or cancel August recess in order to get this done. So there's not there's not an artificial looming deadline in terms of when Congress is going to be here. However, there is a major deadline that already basically expired, which is the expiration of these extra unemployment dollars. So I think that program will lapse a week or two, and I think that's a realistic time frame. I think Senate Republicans will introduce their bill on Monday or Tuesday, but probably Monday, and they'll negotiate through the next 10 days and try to pass a bill that following Friday, which is probably, I think, the 7th, or maybe the 4th. And at that point, if they go longer than that, we're in real trouble, because again, we have almost 30 million Americans that are relying on unemployment. We have this crazy public health crisis, and the need is growing. And I think local governments need the certainty of what to do with the CARES Act dollars. So if they think that they will be able to use the CARES Act for more things than they currently are able to, they'll obviously hold on to the money until they have certainty. So I'm not going to say that August 4th is like or it is the 7th. I just looked at the calendar. I'm not going to say August 7th is like the drop dead day, but I think that is the day that everyone has targeted to pass this bill through both houses of Congress.
Great, thanks. There is a question, and Commissioner Shin, I'm not sure, you might want to unmute yourself. I'm not sure if you're asking about how much more money will come in CARES 2 and when should we think it available, if that's related to the additional money that the state's releasing to us, the $240 million, or if you're asking if this will have any additional money, which I think we currently heard that this may or may not have any additional money for local government. But your point is well taken that the pressure on us once more money's available is really interesting, is that the pressure to use it for our own revenue shortfall versus getting money out for business grants and helping our community is going to be right there in front of you for sure. So,
well, one of the things I was trying to clarify is if we've got X amount of CARES money that was released, even though it's only a portion of what was supposed to come to us, will that money, if they change the rules in CARES 2, will that money be eligible to be used for revenue shortfalls along with future monies?
Yeah, that's a great question. I understand what you're saying. So understanding that we're at 0 right now, but I can't imagine a situation where additional money is appropriated in addition to CARES, but that money has less flexibility than CARES. So if we free up lost revenue for CARES, we'll certainly free it up for additional for any additional money. And I should say, total speculation, but if I were to guess at an additional round, the high number is CARES, is 150 for state and locals. So it won't be an additional huge amount of money, but I think from NACO's perspective, at this point, anything would help. And I would imagine that that additional money would have the sort of pension and rainy day fund guardrails around it, but would be flexible for loss funding. And Commissioner Price Johnson, I see your question there. The timeline extension would be, that's a great question. And the question is basically whether if you extend the timeline, is it only for directly allocated federal dollars, or is it dollars that were sub-allocated from the state? And I would imagine that the only way to do it would be to extend it for everybody. So the wrinkle there is that everybody's fiscal year ends at a different time. But it would.
The challenge is, Mark, just to give you a quick overview, our state put in a limitation that we had to spend our money by October 31st. They actually shortened the time frame that we had. We have been asking for that to be go to clear to December 30th. They have given us the indication that they're open to that discussion, but yeah, we're dealing with something separately here in Washington State about trying to make sure we can at least get to December 30th, let alone if we can get to that 90 days past. So, yeah. If anyone does have a comment, you're more than welcome to raise your hand, press *9. If you are on the phone, you can raise your hand that way. I think you can also unmute yourself by *6 too. I would add, Commissioner Trask, Sharon Trask also asked a great question because we have in fact been tracking this issue a little bit, and it really relates to two things. One, trying to make sure that any additional resources could go directly to counties rather than being held first at the state, and or the fact that, it'd be very good if we could see an equity distribution between urban counties over 500,000 and counties under 500,000. So those are two pieces that I know our members have been tracking and asking for pretty consistently since the first CARES funding.
And if I could just comment on that, NACO was instrumental. We wrote the legislation that in the House version, the money called the HEROES Act, which I didn't talk about a lot, but would give $375 billion to local governments over 2 years. The HEROES Act is a direct allocation from the federal government through Treasury to every county in America. And for us, as for you, that is the preferred method of distribution.
Yeah, okay, thanks. Yeah, there's a conversation in there about, again, the state will need to extend their 1031 deadline, and then we'll talk about that here shortly with our OFM letter dealing with CARES funding. So we'll talk about that in our state imposed deadline here shortly. Any other questions for Mark? Mark, I know it's getting late back there. We really appreciate it. Thank you very much for joining us. We'll get your slides and get those out to folks on the call as well as folks that were not. Any last moments, any comments before you get to enjoy your Friday evening?
Just thank you all so much for having me. It's an honor and a pleasure to be able to talk to you tonight. Thank you.
Yeah, Mark, thank you very much for joining us. Greatly appreciate it. And thank all of your NACO fellow staff members for all that you all are doing for us. So really appreciate it, Mark. And welcome to NACO, and look forward to hosting you out here in the real Washington once COVID breaks free and you can travel.
That would be great. Thank you so much.
Great. Thanks.
All righty.
All right.
Bye.
Thanks. All right. Let's continue on the CARES funding and talk about that. We sent out a letter that we received from David Schumacher, the Director of Office of Financial Management. We sent that out to you, gosh, I think it was Wednesday night, if I'm not mistaken. Time flies when you're having such a great time. So, but I believe it was Friday night that we sent to you a letter that David Schumacher had in fact put forward to us, and actually went to Commissioner Gelder as president of the association, and we were able to really articulate what was happening with their perspective in releasing the additional amount of resources that were coming forward. As many of you know, they put out, we estimated that there's about 540 some million dollars that were available, 545 million. The state put out 297 million in funds to cities and counties under 500,000. We had been pushing and pursuing those additional resources. In the end, if you read the whole letter, it can be really summed down to this, that Director Schumacher has directed Commerce to begin to amend the contracts to release the additional coronavirus relief funds, which are about 240 million. And we are assuming, although we've not seen the spreadsheet, that it'll be based on the same formula for cities and counties based on the per capita amount, and that they continue to be open to extending the time frame of contracts past October 31st. There was not a commitment to do that, but there's a continued ability, I think in particular, once they start to see that jurisdictions are in fact spending those dollars and are getting close to having those dollars exhausted. So we are optimistic that we will extend that 31st deadline, and even more so now that maybe there'll be a bill that would allow us to have till 90 days past our fiscal year, which would be the end of December. So that would allow us to use those funds well into March of 2021. So that's just a summary of that letter that Director Schumacher sent to us. Happy to answer any questions that you might have associated with that. We talked briefly with the state about if there's anything else coming. I think a number of us at the staff were waiting for the butt or the other foot to fall, or there was something else to occur. But at this point, we, I think, are pretty optimistic that taking that letter exactly as it was, which was that they will begin to get the additional resources of that 240 million into your agreements. And I've not seen the spreadsheet yet to tell you how much that's going to mean to each of you, but we are working to secure that. So happy to take any questions either in the chat box on that issue, and or you can unmute yourself and ask questions or raise your hand. And if you haven't seen that, it went out, it did go out Wednesday night to you all. Don't see anything. I do want to thank Melanie and Jamie. This is an issue we talk, and many of you as well have expressed either in writing on these, when the governor's office has been on these, they've heard you well. They got tired of hearing us about this from us. We had great conversations continuously with the governor's office about releasing these dollars. They were in conversation with the legislative branch about release of these dollars as well. So thank all of you for kind of making this a major issue with folks that you talked about. Do you have, Commissioner Trask, I don't know. All I can tell you is that that Commerce was asked to begin to draft those amendments. So I don't know when the release of these dollars will be coming forward. We're trying to get that information, as well as being able to tell the counties exactly what that amount will be as well, because they must have the spreadsheet that can really tell you what it's going to be. And so at least getting that number to you right now as well. All right, I am going to stop there. There's a question about, will there be any direct funds from the state to LHJs? I don't know the answer to that yet. I know that the Department of Health has been talking about the potential of that, but I don't know whether those decisions have been made. We've actually been asking the state for a little bit more transparency on how they are going to use their 1.6 billion. So that could help inform a little bit more about how we might use our 240 million. So for example, if they're going to continue to provide more state funding for local business support, that might be something that we don't feel the need to. Or likewise, if they're going to provide more funding for tracking and tracing from the state, that might mean something that we don't have to provide resources for. So we don't know some of those questions, answers to those questions yet, but those are the ones very similar to the ones we're asking. Those are good questions. Other questions?
Eric, if I could just add to that.
Yes.
Locals have been directed to hire a lot of people for contact tracing, and that's one of the requirements for the phased approaches and things, is that they would have certain staffing levels, but there hasn't really been any funding that has, the funding that they've received from the state is not sufficient to cover that requirement. So it's an ongoing conversation that we're a part of, and we're hoping that, you know, it's like an emergency unfunded mandate, essentially. And so kind of communicating that ongoing need to Department of Health and to the governor's office on that.
Great. While you're talking, Jamie, you want to roll right into, speaking of roll, the Safe Start rollbacks. Talk about see if there's questions that we might be able to provide for that. I know we probably, I can't remember if we have a variance call next week or not, but on Tuesday, I can't remember if we do or not, or Monday or Tuesday, but anything you'd like to add there? We say updates available here, but I don't think anyone can actually click on that. So maybe we can send out more information about that. So anything on Safe Start rollbacks you'd like to add?
The only thing I want to add is if you weren't able to see the governor's press conference yesterday on that with Secretary Leisman, there are updates on the Safe Start website, as well as the governor's coronavirus Safe Start pages on what specifically was rolled back. There are a number of things in phase 3 that have gotten reduced, things like that, that are going to impact probably a lot of the things that your communities are looking forward to. So that's kind of where we're at with that. Commissioner Shin, your about regional Safe Start restrictions, that's something we can bring. Ultimately, that's the governor's decision. I will say that there's nothing really prohibiting anything from a regional approach for some respects. I know the peninsula was an area that was doing a lot of kind of their openings and their applications for variances together. So there might be ways for you all to explore what you can do right now as a region together without really kind of getting that blessing from the governor. And that might be something that WASAC can help facilitate, so that we're not, so if we're able to go ahead with things, we can do that. And yes, Commissioner Price Johnson, transparency from the state, absolutely. And I don't know when that's going to happen, how the state is spending their CARES funding.
Yeah.
Commissioner Fund weddings outside, any more info on that? Yes. Weddings can be outside. I believe they are still restricted to social distancing, and I would have to look specifically at those guidelines. Ceremonies are allowed, receptions are not allowed. So that's something to keep in mind, is that the ceremonies can happen inside and outside, receptions cannot be happening. It's all about the lingering and the mingling of people that are outside of your household is what a lot of the rollbacks are trying to reduce.
Commissioner Shin, I just want to add a couple of things to your comment. We had a conversation with the governor's office. The governor actually talked about adaptation, and one of the things that we began to suggest was something similar to when we had to initially submit our phased plans to go to phase 2 or go to phase 3. We had to submit a plan based on a set of criteria. And part of the discussion was, could we begin to look at, okay, we're in counties or a region where we are seeing, we're not meeting our goals, we're not meeting our targets. We're seeing that R naught number that is way too high, turning that back to us to begin to say, okay, what do we need to do as a region or as a county to bring that number back down, is taking some greater responsibility and resubmitting a plan. So there is some conversation about how do we perhaps take some greater responsibility at our own end for adapting our phase plans when we see jurisdictions that are seeing surges. And Yakima County is a great example where a surge occurred, and they are actually bending that. And so we know it can, in fact, can occur, but the state did have to come and impose some things. So, yeah.
Eric, I'll just say really quickly in regard to when will we get more information on these. I was told this afternoon by one of the governor's staff people that they are working their hardest to get that out by close of business tonight. So even if it's after hours, as soon as I get that, I can send it out if people would like it, or you'll just know that it should be going up online this evening and can check it out there.
Great, thank you. We will definitely get that. Commissioner Trask, you asked a great question. I know that Jamie can provide you some assistance with that. Yes, there are jurisdictions that are contracting out for some of the contact tracing using outside firms. Jamie, you want to talk about that?
Yeah, we have early on, Department of Health was able to do a lot of the surge that we needed them to for contact tracing. Department of Health is also at their capacity for what they're able to do because they need to shift their staff back to their regular work. I know you guys are experiencing the same thing at the local level. You need to get your environmental health staff back doing their work, et cetera. So we do have a number of counties that have started to do contracts with something called the Public Health Institute, specifically Clark, Skamania, I believe Cowlitz and Spokane have already started this work in this contract, and I think there's a few others that are considering working with them. They are working exclusively with Washington State and I believe Oregon, so they're local, they know our state. They have a pretty good relationship with a number of our local health jurisdictions for other things that they've done in the past with them. And so if there's an interest, I know it's been shared out with to our local health jurisdictions. We've talked about this on our WSALFO calls, and I can share it out again with them. absolutely. I know your staff they're very tired, and they need that help.
Yeah, we just had the call, days fly together. I think it was Tuesday afternoon. This was one of the specific subjects, Commissioner Trask, that the local public health directors, doctors were talking about, and there was an exchange of information about who was using contract companies and how that was going. So, yep. All right. Let me just transition. We are getting to 4:30, and I know a number of you are starting to see the call drop off. I just want to let you know one additional item that we are working on, and it really does directly relate a little bit to Commissioner Trask's and a number of your comments about fatigue that is occurring in whether it's public health nurses or public health. There have been a number of jurisdictions that I've talked to, their health directors or folks that frankly haven't had a day off since March, and fatigue is an issue, morale is an issue. There are some communities that are loving on their public health folks, but there are some communities where their public health folks have been, whether it's accosted or in some cases, you have sheriff's deputies posted outside of their house because of death threats. And this has become a really big issue. So we have been working on a public health resolution that we will send out as a model for you to utilize to hopefully proclamation type thing, to really thank the phenomenal work that your staffs have been doing. I know not everyone fully agrees with perhaps what is being done and the manner in which it's been approached, but there is absolutely no question that the dedication of your public health staff and really county staff across the board here, but the work and the dedication and the commitment to public service and their commitment to their community is truly beyond what perhaps might be expected for them. And we're just going to do a sample proclamation resolution for you to take a look at. We'll send that out to you. We just believe it's really important to recognize the work of our county employees, particularly in local health jurisdictions right now, and give them the kudos and the appreciation for what they are doing. And we'll get that out to you to take a look at. So thank you all. Hope you'll receive it with an open mind. I can tell you that I spent a number of years as a county employee and then as an elected official, and I can't, as a county employee, getting accolades from the elected county commissioners really did make you feel really good. And so I just hope you can be able to do that. So thank you all for being open to the idea. We'll have that out next week to you. We are also going to ask the governor's office to do a proclamation thanking the work of our local health jurisdictions as well. And appreciate that. If there's any other questions or comments, there's some good chat going on in the chat box. So hopefully you'll take a look at that. We appreciate all that you are doing. We've got, we're continuing calls with our affiliate groups, the departments underneath you. So that's been very appreciative and going well. Some of those are dropping off a little bit, but some of those are staying very strong. And it's been real positive. So appreciate that. If you have any questions for myself, Melanie, Jamie, any of our staff as it relates to COVID-19, we seem to be back in a little surge. So we're spending a lot more time back into COVID-19 than we were for a little while. But I'm not sure on whether do we have calls Monday and Tuesday this coming week, or is this our off week? I can't remember. Melanie or Jamie, you might be able to look closer, but I think we are off.
It is an off week, so we will be back in August, which seems crazy because July just flew by, but yes.
Yeah, we have no calls. We do have an LSC meeting for those of you that are on LSC, Zoom meeting starting at 10:30 to noon on on Wednesday, the 29th, though. So please make sure you tune in for that. Is there any last minute? I left my screen to check on, see if there's anything else. If not, thank you all for all that you're doing. I know this is a super busy time for many of you who have a second full-time job running for your job again, in addition to governing right now. And I know that's quite the burden. I've lived that before and glad I'm not the one living it now. So good luck to all of you, and thank you for all that you're doing for county government in your communities. We will talk with you in 2 weeks. For many of you, we will see you next Wednesday on Zoom at the LSC. And even if you're not on LSC, you are more than welcome to Zoom in and observe that as well. And we can get you that information. So everyone have a good, safe weekend. Mask up. What is it? Mask up, wash your hands, and watch your distance. So how'd I do, Jamie? Did I do good there?
Very good. Spoken
All
like
right.
a true public health advocate.
I know. All right. Thank you all.
I want to take a little rest.